The House Oversight Committee will come to order. Madam Clerk, can you take attendance?
Chair Johnson.
Here.
Representatives Outman.
Here.
Whittinga. Here. Riley.
Here.
O'Malley.
Here.
Wozniak.
Here.
Brixey. Here. LeGrand.
Yes.
Young. Here. Mr. Chair, you do have a quorum.
Thank you. And Representative Outman moves to adopt the minutes from the February 11, 2021 meeting. Without objection, the minutes are approved. Then Representative Riley moves to refer the House Oversight Committee Auditor General Report on the Flint emergency expenditures from January 2021 to the Appropriations Subcommittee on Health and Human Services. Madam Clerk, can you take the vote?
On the motion to refer the audit, Chair Johnson.
Yes.
Representatives Outman.
Yes.
Whittinga.
Yes.
Riley.
Yes.
O'Malley.
Yes.
Wozniak.
Yes.
Brixey.
Yes.
LeGrand.
Yes.
Young.
Yes.
Mr. Chair, you have 9 yeas, no nays, no pass, with that the audit is referred to the Appropriations Subcommittee on Health and Human Services.
Thank you. All right, with that, we will move on to the nursing home portion of our committee. So just to give a background to why we're here today, what brings us here, as you probably saw a lot of headlines, what's going on in New York with Governor Cuomo, where they were hiding the numbers there. I know your offices probably have, I know my office has received a lot of constituents contacting, wondering about similarities here. And so just to kind of go back, we're almost a year into this now, and when this first started, there was 5 states that were putting COVID patients into nursing homes. Michigan was one of them, New York was one of them as well. And the Trump Department of Justice at one point in time decided to do an investigation into this, look into the numbers. And the secretary to the governor in New York, Melissa DeRosa, was told Democratic leaders in a video conference, quote, "We froze," when they heard that directive. And that's when it came to light that they were actually hiding the death numbers in nursing homes. They were only counting those. What they did is basically if you contracted COVID and died in the nursing home, they counted that. But if you contracted COVID in the nursing home and then were admitted to a hospital and passed away, they didn't count that purposely. And we would never have known that they were hiding those numbers had it not been for this person to slip and say that on a recorded line. So their numbers went from 8,700 deaths to over 13,000 deaths when you get the right information. Now, Michigan was one of these states as well that, was doing this, was under investigation, so the question was brought to us, how do we know that this didn't happen here? Okay, it's a fair question, so we reached out to the department, we asked them, and they said, nope, we are counting those numbers accurately. All right, I assume you're gonna tell us that, but trust but verify. So we then asked, can you give us the breakdown? How many died in the nursing home and versus how many died admitted in a hospital? DHHS said, you have to talk to the county health departments to find that information. So then we reached out to the county health departments and they said, you need to talk to DHHS to get those numbers. So both sides are pointing at each other. To me, we know New York has that breakdown. We should have that breakdown. If you don't, how do you know that you actually are accurately counting those numbers? Now, so right now in Michigan, we actually have the 14th highest COVID nursing home deaths per 100 residents in the nation. And that's with what we have right now reported. Now, most of you guys got a letter last night from the director in response to what we're going to do in committee today. We did ask them to testify. We asked them last week. We really wanted them to testify because there are questions that need to be answered. They refused to testify. They sent us this letter instead. If you read through it, pretty much what it said was, well, we're doing everything that we have to. We have the greatest data out there. We're collecting everything like we're supposed to. But they didn't actually share the data with us. I'm just a simple guy. But in my mind, if you have the best data out there, wouldn't you share it with people? That seems to me to be a pretty common sense solution here. So looking at the Michigan numbers, and this is very interesting because you read the letter, they say we are working closely with the CDC on reporting these accurately. The state website shows 5,500 COVID deaths in long-term care facilities, 24,000 cases. Now the CDC website for Michigan shows 3,500 deaths versus the 5,500 that the state's website's showing, and only 13,000 cases. So there's a major discrepancy between what the state website is reporting and what the CDC website's reporting. There may be a very simple explanation for this. If they're here, I'd hope they could answer that, but they're not answering that. So that's why these were the questions that we had wanted to ask them. There's a lot of discrepancies in the numbers. We just want to get to the bottom of what is accurate, where are these numbers at. Apparently the email directly to them didn't work, so hopefully in a public hearing like this, we will resend that letter out there and await their response. Furthermore, what these numbers don't count is the deaths in COVID because of the shutdown policies in nursing homes, where you have people that are fading away faster than ever because they're locked down. They can't see their loved ones. You hear stories of people not eating anymore because they've lost their appetite. So these actually don't even represent all those numbers out there. And we've brought forward some people today to share their stories of what they've seen with people that they know in these long-term care facilities. And so that's where we're going to go into at this point. We have Dave Gem and Dalton Herbal. I think they are here. If they could come up and testify here. So yeah, we'll let you guys start things off. And thank you for being here.
Good morning. Thank you, Chairman Johnson, for the opportunity to share some time with you this morning. I'm Dave Game, and I am President and CEO of Wellspring Lutheran Services. We're based in Flint. We serve children, families, and seniors across the state of Michigan. We serve in about 50 of Michigan's 83 counties and serve about 10,000 persons a day. We've been around since 1893, so we've been at this a while, and are sort of unique in the fact that we serve across the age spectrum. We have a very large senior services portfolio of services that brings me here today. So, you know, on March 10th, of course, the world changed for everybody, and restrictions and lockdowns came pretty quick, and no group of people, in my opinion, has been affected more than our elders who live in our care facilities here in the state of Michigan. They've been really without a voice until very recently. Their stories have not been told, and the impact on them has been sort of missed, I think, in the public square. So I appreciate this opportunity to raise their voice on their behalf. They've been scared, they've been lonely, they've been missing their loved ones, as we can only imagine. We know that the psychosocial and the mental health challenges of the pandemic are really hitting every age group. I think we'll find in hindsight that it has been absolutely devastating for our elders who are behind closed doors, shall we say. And early on, we knew very little about this virus, except that it did attack with sort of deadly force older folks with significant medical conditions, which of course describes the folks we serve in our state's nursing homes. They're frail, they're old, they have multiple medical conditions that make them very, very vulnerable. And so, you know, when this began, we didn't have much to fight with. Early on, we struggled to get PPE, and so it seemed restrictions on visitation and lockdowns, if you will, absolutely made sense based on what we knew then. And so I'm not here to sort of relitigate that. What I am here to do is talk about where we're at now and how we got here. So as the initial surge of cases in May began to decline here in the state of Michigan, really across the nation, the Centers for Medicare and Medicaid Services in Washington published a new set of guidelines for us with respect to how we might go about reopenings for some visitation. And that was guidance, of course, for all states to take a look at. And we were very, very hopeful at that point. As we headed into the summer, case rates were dropping significantly, as you'll recall. And so this opportunity for a phased reopening was really exciting for our residents and our staff and certainly their families. So very quickly, under that CMS guidance, indoor restrictions could begin to be lifted based on county positivity rates. And if you were over 10%, there would be, in that county, there would be no visits whatsoever. If you were between 5 and 10%, there could be some limited visitations, and if you were under 5%, still limitations, but more opportunities for visitations for families. And so with that, we started to look at positivity rates, and really between June and October, Michigan, across the board, not county by county, but Michigan in total was below 5% for really from June to October. However, the state of Michigan did not adopt those guidelines and, or otherwise take them up really in any way. What we did in Michigan was we sort of created a different version. Instead of having 3 levels, there are 5, A through E. And it's based on an algorithm that was created by the state working with the University of Michigan School of Public Health. And that algorithm has frankly confused us because as providers, we look at that algorithm and we see that there are many counties running below 5% positivity, and yet on the My Safe Start map that guides us with respect to the state's policy on this, we're at an E level, which means no visitations are allowed. So sadly, we really are essentially functioning under the same set of restrictions that were in place back in March of 2020. There are some exceptions, so I don't want to misrepresent that, but the core of the visitation policies right now are substantively the same as what we were experiencing back in March. So just by way of example, looking at the numbers from last week, if Michigan had implemented the CMS guidelines and we applied them to the data we had last week, there would only be 2 counties in Michigan unable to open for some sorts of visits under the CMS rules. Applying the state rules, however, we had 38 counties that were at that E level and therefore had no visitation. So you see the difference in that. And for some specifics, Ionia County recently was posted at a 10.1 positivity rate. Saginaw County was at a 3.3. Yet on the My Safe Start map, they were both level D, meaning Ionia could be open, even though if you applied the CMS data, they wouldn't be open for visits. And Saginaw at a D had some very restricted visitation, but if you applied the CMS rules, they would have been much more able to accommodate more visitors. So that's one example. Lenawee County is interesting as well because it's at a 4% positivity rate this past week, and a level E on the My Safe Start map, meaning no visits. So those examples to me underscore the opportunity and the importance for us to think about a more nuanced, maybe locally determined policy that takes visitation needs of residents to heart. So the other thing I would say is that conditions have changed so significantly since we started this back in March of 2020. We now have adequate PPE. We have inventories. We're ready if another surge comes. We have that. We have weekly and biweekly testing as needed for residents and staff. We have the ability to do rapid tests at the door. We have therapeutics that lessen the severity of the illness. Monoclonal antibodies have proven to be very effective in the elderly and are available. And of course, we have vaccines. And the vast majority of care facilities in Michigan now have been through their 2nd and even 3rd vaccine clinic. We're seeing numbers between 85 and 95% uptake by residents in those facilities. And interestingly enough, there's studies coming out now that looked at facilities who, after their first vaccine clinic, saw a 48% drop in cases, whereas facilities that had not had any vaccine clinic yet had only seen a 21% drop. So as a community drop, you would expect that. But we saw more than double the rate of decline already in those facilities that had their first vaccine. So we know that's beginning to work. So we would just offer a revised policy that could take into consideration opening up under certain conditions for residents that have the vaccine. They've got strong immunities building. We would rapid test families at the door, and we can do that, and then clear them for entry. We would allow visits in separate rooms that are not inpatient areas that would be sanitized between visits. We would limit visitors to 2 per family for an hour, and of course, masks and some distancing would be required. In our opinion, those would be very safe conditions given what we now have and the vaccines in 90 to 95% of the arms of our residents. So we are seeing physical and cognitive decline in our residents. The chairman mentioned you know, the lack of appetite. People are just giving up. And now that we've got the vaccine to the extent we do, there was great hope among our residents as they took those vaccines. They had assumed that by doing that, this was their ticket to see their loved ones. And yet nothing has changed, and some of these vaccine clinics go back to late December. So what we need to recognize is the impact on these folks, like anybody in life, if we lose our sense of purpose, we begin to decline. Our overall psychosocial, spiritual health and wellness begins to decline when we lose purpose. What we need to recognize is that for our frail seniors who are in assisted living facilities, in nursing homes across this state, family is their purpose. They don't have a whole lot left. And by allowing this to go on, we're seeing that decline happen faster and faster now. And so, you know, for us, there will be a time that we look back at this pandemic and we will recognize that we lost some things, we missed some things, we had to cancel events, we didn't get to do things, we didn't make memories that we might have. But we'll look back at this as a time in our life and understand that it was part of that. But for our residents, this isn't just a time in their life. For many of them, it's the rest of their life. And so it's time for us to open up. And really, it's time for us to hear their voice and to give seniors a say. So thank you.
Thank you. I believe Representative Brixey has a question.
Thank you very much for coming and sharing your concerns with us. I have a couple questions. Is your organization a nursing home, or do you serve people in facilities?
We operate 4 nursing homes in the state of Michigan and a large assisted living facility. We also do a fair amount of affordable housing for seniors as well.
Okay, and so I'm quite confused by your comments because the work that I've experienced in my office with DHHS is that most of the problems that we've had with our constituents wanting to visit their relatives in nursing homes are arising from not from the governor's orders, but from the nursing homes taking steps above and beyond the orders that are in place. So, for example, last May, we had a woman who had come in from out of state. Her mom was very sick and was dying, and she was in the hospital. And then she got discharged into a nursing home on hospice. And, you know, they only allowed the outdoor visits. And we discovered that it was their own policy that was preventing them from allowing them in. And we did work with them, and it was complicated because they own facilities in many different states, and they have a complex series of regulations. So, are your regulations based on which orders are you using? Because people can visit as long as you're COVID-free within 14 days. You can have visitation.
So if I may, the guidelines as we understand and apply them is that a facility, once it becomes a D level or higher, that is A, B, C, or D on the My Safe Start map, and hasn't had a positive case in 14 days, can begin to open up for very limited visitation, which is why I underscored the difference between what we're seeing in CMS level positivity rates and what we're seeing on the My Safe Start map, where we have facilities that are at 4% positivity rate counties haven't had a case, and yet they still show up as an E on the My Safe Start map. That's where a lot of the confusion is coming. With respect to end-of-life visits, those have always been allowed all the way back to March. But I think we've had some just different interpretations of that over time. I think providers weren't clear, and probably in some cases still aren't clear, what end-of-life visits really mean. Some interpreted that to mean that residents had to be actively dying. And so, you know, that's an art, not a science, when you're looking at someone with these levels of frailties and on hospice. And so I know that it's a constant conversation to look at every case by case and say, can we apply this to the guidelines as we understand it?
Thank you for that. Oh, you have another question?
Yeah, aren't some of your facilities, are any of your facilities allowing visits?
So we are. We have a couple of facilities that are in D level and have not had a case in 14 days, and so we sort of hang on the thread of hoping we don't see another case pop up. But we have a couple of facilities that started visits last week, and I'd love to describe the joy that's creating for those folks. Limited, but available. And
Did you happen to see the news this morning? I saw they released some new information about the dramatic drop in nursing home deaths across the country, which really made my heart sing, because my parents are in a facility themselves, and so to see that we're beginning to gain the upper hand in this is something that's very comforting and hopeful to me.
You're referring to the article in the New York Times, I think?
Yes.
It was a great article.
And that's what we base our information is on the news.
And so just to, sir, you're out of order. So I've heard a lot of stories on this where people in facilities where you have that 14-day window, and so they'll schedule out appointments for family members, on that next day, and then day 13 in a large facility, one person gets COVID, and all those appointments are canceled. And it's just, they keep clinging to this hope of, all right, I'm going to see my family members, and then it just gets taken away from them. And it's just despair for these people.
So we actually had that happen in one of our facilities. We were gearing up for visits, and a staff member case popped up. Frankly, we're not even sure it was related to work, but nevertheless, you start that 14-day clock again, and we had to cancel visits at that point.
Representative O'Malley.
Thank you, Mr. Chair. Thank you for your presentation today. A couple of quick questions. First of all, to some of the points and questions that were raised already. With over 1,000 frequently asked questions and this sort of thing, when your organizations and groups like yours get these new rules, they're not always crystal clear, are they? So there's confusion as to their interpretation?
So that's absolutely right. A lot of guidance comes out. In fact, at one point, I haven't looked lately, but at one point, the inventory of guidance we had received from something like 12 different overseeing bodies, national, state, local, was somewhere over 300 different pieces of guidance that we got. Some having to do with labor law, some having to do with visitation, some having to do with infection control. I mean, you name it. And so we're constantly assimilating that, trying to interpret it, trying to apply it, and frankly, trying to figure out what previous guidance this supplants or doesn't it, right? And so I think that's just the condition of COVID, though. I don't think that's anybody's failure. I don't think it's. I just think it evolved quickly. I called March and April for us the sort of the fog of war, because everything was coming at us fast. And while that's settled down a bit, there's still a lot of regulatory guidance out there for us.
Sure. Quick questions. When it comes to guidance from DHHS, how timely are they? And I'll give you my example. When I was in the Oversight Committee over the summer, talking with Dr. Gordon, and there was the visitation. Well, we're outside, that's great. But it was already late September. We were heading into October. My community, temperatures are dropping. And they didn't come up with any indoor suggestions for several weeks after. So I'm just curious as to how timely this guidance and new rules come from DHS, in your opinion.
Yeah, so I think DHHS has done everything they can to stay ahead of things. Having said that, we of course would like guidance sooner rather than later. We have been asking for consideration for indoor visitation since really May and June, particularly after the CMS guidelines came out. We were very interested in in getting guidance from that. It did come out later in September, but again, it was a different sort of a different model that didn't really approximate what CMS had offered.
All right, and one last quick one. The governor's task force on nursing homes came out, and when it hit, there wasn't a big move to implement those. Where are they at on the task force recommendations?
Yeah, that's a good question. There were multiple task forces underneath that major task force, and I would have to get back with you on that specifically, but I would just say that some of those recommendations were implemented, some have not been taken up. I sat on the sub-task force on staffing, and we've seen a little bit of movement there, but we've got a lot more to do on that.
Thank you, Mr. Chair.
Thanks. Representative Outman.
Thank you, Mr. Chair. Are you seeing patients at these long-term care facilities being vaccinated at an adequate rate?
Most of our facilities are over 90% for residents vaccinated with both the first and second dose now.
Okay, that's terrific.
And that's the data across the state that we have.
Okay, I would say in my district, that's not the case, but
For residents?
pardon?
For the residents of these homes?
Correct.
Okay.
Yep. So I was just curious to see if that was the case in your opinion statewide. So thank you.
They're at 90%. They should be open in my mind. I mean, that's well over the goal. Representative Riley.
Thank you. Well, these COVID hearings are kind of like just beating a dead horse, but I'm going to ask you this question anyhow. From your testimony, I would expect that you were going to say that you're okay with guidelines, but all the thousands of decisions that you make daily would be best left in your hands instead of the state of Michigan telling you what to do on everything. Would you agree with that?
So I would agree to the extent that we need to have the regulatory guidelines that create the sort of guardrails and safety nets for our frailest people. Within those, to be able to make good local decisions based on what that facility, community, county is doing with respect to COVID makes a lot of sense. And you know, we're motivated by the care for our residents. Our staff have been their family, and it is breaking the hearts of people who have dedicated their lives to serving these frail seniors to watch this go on, and doing everything we can to advocate for a change in this policy. But I think with local health departments, with the data we have, with the testing we have, with the vaccinations having been done now, I think good local decisions can be made within the guidelines.
Thank you for that answer.
Representative Young.
Thank you, Mr. Chair. Thank you so much for being here today. This is so difficult because we care about our seniors, we care about families, we care about kids and virtual learning. And so I'm curious to know that whether or not you all offered any type of video conferencing. The one thing we know is that there's nothing that replaces personal contact, but I know in Detroit we did a full-fledged effort to get tablets in homes so that people can still see loved ones and hear their voices, and if you did, and it looks like you did, what was the response of some of those residents?
Yeah, we did. We bought what we could. We frankly had a wonderful outpouring in our communities of folks donating sometimes used, sometimes new tablets and so forth. And they worked well enough to get face-to-face visits. The challenge that we face is that, particularly for folks with memory care and dementia, that in most cases added to confusion. Never having done that before, taking a 95-year-old who's had dementia, has trouble recognizing family already. Frankly, we've witnessed, we've noticed folks sort of looking behind the tablet because they didn't understand what this was. And so it didn't work for everybody by any means, but I think facilities across the state leveraged that as much as they possibly could.
Representative Wozniak.
Thank you, Mr. Chair. Thank you for your testimony. I'm an elder law attorney, and I'm very familiar with your organization. Your group does great work throughout the state. We're very fortunate to have you in Michigan. And thank you for coming today. So I have two quick questions. First one is, how are you doing with staffing vaccinations? And number two, how are you paid for the COVID people that came into the nursing home?
So staff vaccination rates are lower than residents, certainly lower than we'd like even. We have facilities that are in the high 60%. We have some facilities in the mid 30%. And frankly, there's been just a challenge getting staff to accept the vaccine for all kinds of reasons. Some because of faith beliefs, some because of their own personal health concerns, some because we know there are racial and ethnic disparities in healthcare and in how this disease has affected folks, and so there's been just hesitancy. So we continue to try to educate and push and support that. The question with respect to payment, payments for us didn't really change. When somebody would contract COVID, CMS did change the rules for a period of time under which we could put somebody, say, off of Medicaid onto a skilled Medicare visit because their conditions had changed. Normally, you need a 3-day hospital stay before you can do that, right? So, so payment would change because conditions change, but not because the payment system changed for us. Obviously, we have other additional revenues coming through CARES Act grants and other things that helped offset the additional costs somewhat and so forth for PPE and now for testing and that. But the payment mechanism didn't change.
Brett Brixey with a brief follow-up.
Brief follow-up. Thank you, Chair. Sir, I have one follow-up question. You're asking us to, if I understand you right, you're asking us to implement a new policy that would kind of free up and allow more visitation. Yet your Fairview facility is allowing indoor visits, as you mentioned. But you have a restriction in place that is more strict than the DHHS requirements, and that is that you don't allow your own residents who come in to have any visitors for 14 days, and that is more stringent than the requirement that the state has.
I'll have to look into that. I'm not aware of that.
We called and verified this morning the rules, and I think it's just a good example and illustration of the complexity of this issue and how vitally important it is for us to balance people dying versus the negative impacts of isolation. And, of course, it's our goal to get everyone vaccinated and to improve those numbers in any way, shape, or form that we can. Do you have any ideas how we could?
All right, you said brief follow-up. Sorry, I'm going to cut you off because we got a lot of people to testify today. Sorry, we got to stop it here. We're going to move on to the next person. And so just in response, this is a very complex issue, and that's why there shouldn't be one statewide mandate on every facility. Each facility is different. They each have their unique needs. You need to allow them to be flexible to fit their residents' needs. With that, we have next is Pete Lucido, who is the new prosecutor in Macomb County. He is on Zoom. And with that, we will let Pete take it away.
It's great that we can't hear you, Pete.
You are on mute. Can you unmute yourself?
Good morning, everyone, and thank you, Mr. Chairman. It's great to be back in Lansing, but by Zoom. I'm appreciative of the fact that you've given me an opportunity to bring forth some information, I think, that's going to be helpful for the committee, but also to create a policy that going forward would lend itself to a beneficial attribute to those beloved seniors that are the most and that are the most at risk. What we've learned over the last year, because it's going to be on a 1-year anniversary from March of last year to this year, is that we had a pandemic, we all knew it, and how we dealt with it was something unique and different in all different states. Unfortunately, our state has failed the seniors in the way we reacted after we knew that it was killing seniors in the nursing homes. So let me just get right to it. On March 10th, 2020, it'll be the 1-year anniversary that the Department of Health and Human Services identified the 2 presumptive positive cases of COVID. The executive orders were issued under the Michigan Constitution of 1963, as well as the emergency power of the governor of the Act of 1945. That's all pursuant to the statutory law that we have to follow. These executive orders, literally, because we didn't know what we were dealing with, gave some inordinary responsibilities to the nursing facilities. And let me explain. The nursing facilities were told what to do, even though they weren't part of the discussion, when the governor had MDHHS, Robert Gordon, who's no longer with us, as well as Lara, Orland Hawks, as directors in place to get their input from the nursing home facilities, or HCAM, Healthcare Administration of Michigan. HCAM sent a letter in April, and I'm sure you should have a copy of it. If not, I'm sure my old office would be able to supply it, clearly indicating that they are not equipped to handle, number one, the PPE, which was been fighting over from the hospitals that were first giving the care. In addition, they indicated that their skilled labor wasn't skilled to handle a pandemic of a virus that no one knew how to deal with, how to treat it, how to go ahead and care for those individuals. Lastly, these people that run the nursing homes are licensed under LARA. So with all due respect to LARA, why wasn't their input there, and why weren't the individuals at the table that actually license these facilities as to what the license actually is there for? So in addition, we had unskilled workers that were working, doing the best they can with the PPE that they had, that were spreading the virus rampantly throughout the nursing facilities. We went on to learn that a couple other states were doing the same, such as New York. And at the end of the day, these regional hubs that were set up, which was the TCF, which was formerly known as Cobo Hall, as well as the Novi Expo, were set up with medical beds, set up with PPE, set up with drapery between it. The question is that I ask Mr. Chairman and members of the committee is, did they get Medicaid and Medicare approved prior to this occurring? Was there some order? Was there something from the president? Was there something from the Congress, the Senate, that indicated that this was Medicaid approved, Medicare approved, so that the payments could be made? Because unfortunately, if you go to put something in place, how are these people going to get paid? We do know that the facilities that were the nursing facilities were Medicaid approved. And we also know that they received an additional $5,000 extra for patients that they took care of that were COVID positive. That much we do know. But what were the issues that we don't know was, why is the Department of Health and Human Services that are charged with looking at those numbers in the nursing homes, why didn't they do their job properly and have recordation of those numbers? That's what I want to know. In addition, I want to know, why did Lara, who licenses these facilities, not go out and first see that these facilities were equipped to do the job of which they're charged with and doing the licensing? And then the last thing is, if you look at nursing homes, long-term care health facilities, memory care, group homes, the numbers were exponential. The question is, was the protocol, if there was one, followed properly, or was it breached? Who was responsible to see that the protocol was followed? Who from Lara can attest that they went to see, I think, over 430-something nursing facilities throughout the state? Was there a breach in the way the business of the government was doing their business? Lastly, Mr. Chairman and members of the committee, the record keeping of accurate and current data regarding the quantity in each type of PPE had to be recorded. But in addition, DHHS was charged with a responsibility to make sure that these individuals were protected. Protected. That's what their job is, to give the best care this state knows how to deal with. Their budget's the largest. They should have had the proper individuals there. When the governor ordered that these units, these nursing home units that were 80%, that they create a dedicated care facility within their facility, who was the one charged with making sure that it met the standards that the governor wanted? And then the last thing is these regional hubs. Somebody's got to tell me, since they were created, why can't we get an answer as to why they weren't used as the intended purpose under the order? If one is available, they're supposed to accept the residents. They must send the residents from the hospital to the regional hub if there's not a nursing facility available, or that they don't have the proper. Now, Mr. Chairman and your members, you all know about the bills that went through. We received bipartisan support on the first bill that I authored that was vetoed. There was a second bill that was authored, and it was almost unanimous in the Senate, and I believe it was almost unanimous in the House that was finally signed into law. That was tragically after thousands of individuals died in nursing homes. Mr. Chairman, I stand ready to answer any questions because I do believe that even in New York, where they had the big boat come over, that boat was never utilized, but the nursing home deaths accumulated. The question is, why were these hubs set and why weren't they used? And it's never been answered. Would that have circumvented the death of all of those loved individuals and those family members?
Thank you. We have a lot of questions with no answers. That's the sad part here. Representative Wozniak.
Thank you, Mr. Chair. Thank you, Mr. Prosecutor, for coming today and offering testimony on this issue. I know you're like I am as an elder law attorney and being involved with older people. They're like voices in the desert. They're crying out. They don't have anyone listening at this time. Back in May of last year, you wrote a letter to both U.S. Attorney Matthew Schneider and Attorney General Nessel. Do you remember writing that letter?
I do. I wrote the letter, and I appreciate the fact that you're bringing that up. This was now, again, almost a year ago come May, but after listening, and I was a member of the Oversight Committee. In fact, I was the vice chair in the Senate, and I was also brought forth two doctors to health policy that I collaborated with, one 40 years experience and one 30 years from the district, and both of them had indicated clearly there was no guidelines that they could see to put infected patients in a nursing facility with the most compromised individuals that we have in our society, the elderly. But I wrote those letters with the full intentions of not having the numbers and not knowing why we're breaching federal law. Federal law, it's a breach not to have those numbers provided for Medicaid and Medicare, yet we're getting paid by them and an additional bonus of $5,000 to the nursing homes for taking in these patients. I asked whether the investigation could be had right now. Don't wait as to what the heck is going on. And the reason why is people were dying, but nobody was standing up. And I figured we need the assistance of the Attorney General, who's charged with the responsibility of overseeing that the laws are being followed, in which lawmakers like yourselves and once myself put into place, as well as federal laws regarding Medicaid and Medicare, whether those were being followed. I asked for a full investigation.
Well, you also asked for a response from each of those people. Is that correct? And did you get a response?
And you, Representative Wozniak, first of all, thank you for taking the leadership role and being my representative in the district I live in. I appreciate the fact that this issue is even continuing the dialogue, because there's been no answers, and we deserve answers as citizens. And I asked for an answer from both the Attorney General as well as the U.S. Attorney at the time, Matthew Schneider. And the reason I asked for it was because we as citizens, we as constituents, we as legislators and policymakers deserve to ask the questions to get the answers back to who we serve.
And what type of answers did you get from those two people?
The United States Attorney, Matthew Schneider, said all life is precious, including the elderly. We will go ahead and begin looking into and trying to discover what it is that happened and look into and delve into the issues that you've raised. That's what I received from Matthew Schneider. Unfortunately, I must report sadly that he is no longer the U.S. Attorney, and that there is now another U.S. Attorney interim. And I'm just trying to get my arms around, are they going to continue that mission and journey that the U.S. Attorney's Office, under the direction and leadership of Matthew Schneider, said they were going to do? So I do have that letter. I'll make that available to the committee if you haven't received the same. But I also received a letter from the Attorney General's office through their, I believe it was their medical or their health policy
health
director,
fraud,
who indicated that we are not going to take any action.
Mhm.
And we believe that everything that was done with best intentions. I don't know what that means. And the reason I don't is because they are charged with a duty and a responsibility to oversee LARA, the licensing division, as well as DHHS, who are spending, I think the budget's around $26 billion with a B, that they're charged with utilizing those funds for the best interests of our health and safety here in the state.
Okay, we got to keep moving on. We got a lot of people to go.
Thank you for your testimony.
Rep. Outman.
Thank you.
Thank you, Mr. Chair. Pete, if I heard you correctly, the governor vetoed your bill that would have prohibited the transfer of people who had COVID-19 into nursing homes, and instead doubled down on that policy. Is that the case, and at what point did that veto take place?
I was really surprised. That veto took place, if you recall, the legislature gave the governor 30 days under both the Constitution as well as her delegation of her powers. We gave her another 30 days because, quite frankly, we didn't know what we were dealing with. But during that period of time, I was learning and getting the information, and the veto occurred, I believe, sometime in June, and it was after the House and the Senate both approved the bill through health policies. We had enormous amount of testimony, but it was vetoed, and it was prior to the Supreme Court making its decision saying that the governor was without power after the legislature didn't provide her additional extensions under both those laws.
Yeah, well, what really blows my mind is we didn't have to do this. We didn't have to shove COVID-positive patients into nursing homes. We literally, like you said, had field hospitals set up across the state, and we didn't even utilize them. So it just blows my mind. But thank you for that answer.
Representative Brixey.
Thank you. Thank you for coming to visit with us. I'm not sure if I should call you Senator Lucido or Prosecutor Lucido. Last year...
Call me Pete. You can call me Pete. That's what my mom called me when I was born, and my dad.
Okay, Pete, and you can call me Julie, and we've called each other
Thanks,
that before in previous meetings. So, last year we spent quite a bit of time discussing this in the legislature, and your colleague, Senator McBroom, at the Senate oversight hearings last year. I know they had one meeting where there was over 5 hours of testimony talking about this. And, Senator McBroom himself, who led the oversight hearings, said, "We have not seen any evidence or testimony that says that a nursing home was forced to take someone against their will." So it's really important that we have the record straight, that the nursing homes...
By the way, new testimony came to light after that, and it was actually true. But I want to encourage you to get to your question, please, because we do have a lot of people willing to testify today.
Thank you.
All right, Representative Hoytinga.
Thank you for your testimony, Mr. Lucido. It's good to hear from you today. So I actually do have the letter from HCAM, from Melissa Samuel, the president of HCAM. And just to reiterate your testimony, they did recommend and offer facilities in the Detroit and Southeast Michigan that could have been used for COVID patients. And from from my notes here, the DHHS director, Gordon, at the time, said that he opposed the idea of putting people in those empty facilities was because there would be issues with PPE and staffing. I guess my question would be to you that locally, when I speak to nursing homes and assisted living facilities, they are also saying that they were lacking PPE, the capabilities, and the, quite frankly, the education. They were so overwhelmed with it. By putting COVID positive patients in the open facilities that was specifically for this, wouldn't that have taken a tremendous pressure off of all of our facilities across the states? I mean, in a lot of these patients, you know, if symptoms lasted a couple weeks and had to be quarantined for a couple weeks, and then if they tested negative, they could have went back to their facilities. But I guess just my question is, maybe it's just a common sense answer, I don't know, but wouldn't that have taken the pressure off of all of our facilities across the state had we followed the guidelines of HCAM and recommendations?
You know, you raised the point that I've asked. And what is the date of the letter, Representative? Do you have it with you there from HCAM?
I do not have the date on it.
So I believe it was early April. It was about 10 to 14 days after the governor issued an initial order about what the nursing homes had to do. And with respect to the governor, we all know, including us as legislators and policymakers, we didn't know what we were dealing with. But HCAM came across the bow and struck a nerve and sent it to the governor, which that copy is available through Melissa Samuelson, who runs the Healthcare Administration of Michigan, or Healthcare Association of Michigan. And she indicated we don't have skilled labor, we don't have PPE, we don't have a facility that's broken down that says separate, because we don't want to spread this COVID. We don't have separate employees that are going to have COVID and non-COVID patients. So they were waiting on patients that were COVID positive, patients that were COVID negative, and spreading it, killing off those poor seniors that lived there. The unfortunate part is had they separated like other states did, would we have effectuated a better result? I can only say past performance of what other states did is the best predictor of future performance of what we should have done.
And I actually
and we're doing now.
I do
with
have
the
an
bill
answer.
that got passed this last time around, it says that DHHS as well as LARA must ensure that the facility has the capability of separate PPE, separate staff, as well as separate parts of the building where COVID is going to be kept versus non-COVID where it's going to be kept.
According to my notes here, it says 3 days after the confirmation of Michigan's first COVID-19 cases was when that letter was written. So she acted immediately, the president of HCAM. So I'm very proud of her for reacting.
Homes, when they came to testify over the Oversight Committee with Chairman McBroom in the Senate, the nursing homes clearly indicated we cannot handle this. Well, if they can't handle it and they're charged with having to handle it, isn't that a debacle from the beginning? That's why we had looked at TCF and we looked at Novi, and I thought that that was a great idea the governor had, to keep COVID in one unit where you have people that were trained and had the expertise to handle those individuals that were most in need of care, that were sick as well as had a compromised immune, being the age that they were.
All right, thank you for being here today, Pete. Enjoyed your testimony. So we're gonna keep moving on here. Next up, we have Lori Millview, and yeah, I think you have a good, touching personal story to share. You could come up, press that red button, and introduce yourself and tell your story. Thank you for being here.
Well, thank you, Mr. Chair, and thank you very much to all of you who are here listening to me today. For months, I have wanted to be able to talk to people who can do something, who will listen, who will care, which I have lots of friends who do, but who are in the position and the power to be able to make a change. And I am here today representing hundreds of people who have stories, who wish they could be here today, having an ear with you and being able to tell their stories too. So I want you to know that I'm also talking for them as well as just myself. And my name is Lori, and this is my son, Bobby, who came along with me. A year and a half ago, my husband, Greg, you can show a picture of me and Greg, he went out for a jog and he never came back home. He was 53 years old, we thought in very good health, but he had a cardiac arrest while jogging, and he suffered an anoxic brain injury due to lack of oxygen from being down until he was found by some Good Samaritans. He's fully dependent for his care. He's unable to communicate effectively with us. He can't do anything. But we know he's aware. He reacts, you know, sometimes they try to do something with him. He says no and pushes them away. So he's locked in, I would say, is what is going on with him right now. After he left the hospital, he was sent to a nursing home where he could receive rehab, and he started getting rehab, and we were seeing some progress. He was eating 50 bites of food, you know, for lunch. And then through insurance red tape, he was cut off from his rehab, and I did fight, and on the third appeal, I did win, but it had been 6 months by then with no rehab and no help. So eventually, I found a doctor, a specialty doctor, who really believes he can help my husband. And we started going, and the second visit we had was March 16th of 2020. We all know that's the day that the restaurants ended up locked down, and before we left that day, they told me, you know, you won't be able to see your husband for a couple weeks. We're not going to allow visitors at the nursing home, and I had been there every day to see him. And so that was devastating to think I wouldn't see my husband for 2 weeks. And now it's been nearly a year, and I haven't been able to be in the same room with my husband. In that time, he hasn't been allowed to receive any help for his brain injury. He lays in a bed, isolated, with no family or friends, other than a daily Zoom call from us, you know, on the screen. He hasn't been allowed to go to see the doctor who could help him. He's had a year now of not being able to receive any help from someone who really, really believed he could help him, because the nursing home won't allow him to go out to do that because it's considered not critical. It feels like he's a prisoner in his nursing home. And I know we talk a lot about seniors, and the majority are seniors, but there's people like my husband who are not seniors, and other residents there that I made friends when I visited. So everybody is, you know, it's not only seniors in there. My husband's facility is one of the hubs that accepted the COVID positive patients, and it was very confusing and hard for me to understand, and really angering, really. And I try to keep my emotion, you know, down a little bit today. I'm an emotional person, but it's very confusing and angering to know that they were bringing in COVID positive patients into his nursing home, and yet I, his wife, cannot visit him, cannot be anywhere near him. We had no outside visits last summer. No one from the facility was allowed to go outside. No one got fresh air or sunshine, and it was very difficult. And we all know that in the best of circumstances, if you have the most fantastic, top-notch nursing home staff, there's going to be things that are overlooked or can't get done. They're overworked. They're hardworking people. I came to really like some of the people that were working with my husband, and I have a lot of respect for them and the jobs they do. But they're overworked, and they don't have enough time to do what they need, you know, what they really would like to do for the residents in the nursing homes. And that's where families step in. Mine and so many others I saw, we visited daily. Every day his mom and I would be visiting him there. And we did a lot of things that we helped out with. And so I just want to go through a few real quick. We would notice something that had been missed. We would trim his nails, because it takes a long time to trim the nails of a brain injured person who doesn't want you touching them. Cutting his hair, brushing his teeth, encouraging him to take sips of water, because once his rehab was cut off, he stopped taking anything by mouth. He's on a feeding tube. He could eat, but he won't eat, and no one was working with him to try to get him to do it. We get him moving his arms and legs, because it helps stimulate the brain. Turn his TV channel, play familiar music for him, because he can't do that for himself. And we provided much needed company, even just sitting and watching a movie. I have pictures all over his room trying to get him stimulated. We were there every day, but now that's been taken away from us, and most importantly, it's been taken away from him for a year now. We all know how important physical touch is. It's so important from the minute we're born, but Greg, my husband, has had no touch from anyone who loves him for nearly a year now. I mean, think about that. If you've had no one that you know and grew up with, or your family or friends, no touch for an entire year from anyone like that, I mean, that is a miserable, miserable way to live, and it's not okay. It feels cruel, and it feels inhumane. And excuse me, but it's very emotional. As many times as I've told him, I'm sure he doesn't understand why we're not in there, why I'm standing at a window, waving and yelling through a window, "Greg, hello, I love you," when I go for my window visits. It's impossibly hard. So many people like Greg have had declines in health, or they've even died. And oftentimes it wasn't because of COVID, it was because of the isolation. And my friend whose father did contract COVID in a nursing home, he passed away this week. After 6 weeks of being in rehab, he didn't go in because of COVID, but he went in for something else, and then he was sent to rehab, and then he got COVID, and anyway, he passed away, 6 weeks of not having his family near him, not seeing them, not touching them, not being able to communicate except through a camera. And it just doesn't feel okay. I brought a couple pictures that my son has here. Well, that's, first we have a picture of him just before the shutdown happened. So that was him. Here's another one of him. And I tried to find pictures that were similar, right? I didn't want to look for like the bad picture, okay? But here's him, at our window visit now. His hair is down to here, my Navy veteran husband, who always liked it nice and short. He doesn't look at us. He doesn't communicate. I heard 4 sentences from him the other day, and it was like a miracle, because since we haven't been able to be in, he just looks down when I call. If he's even awake, he just looks down and looks away. And I just have a couple more things to say. I know our time is short here. I understand it's been a tough year full of tough decisions, but it's impossible for me to understand why my husband hasn't been able to have even 1 or 2 people designated. Why couldn't I be designated as one person who could come in and be with him? The staff, they live their lives, and they should live their lives, They leave work, they go do what they want, they could do anything that they want. And then they come in, they get tested, they put on PPE, and they're there. My husband needs everything. He needs help with everything. So they are right next to him. They're in his face. They're very, very close to him. Why can't I, as his wife, do the exact same thing? I'll get COVID tested. I'll get PPE. I mean, I'll do whatever. Why can't I, or maybe even his mom also, be able to do that with him? And for me, it goes beyond. I know, some people have started reporting, well, we're going to be able to go in and sit 6 feet away. For me, it goes beyond that, because if I go in and sit across the room in a mask, how much does that help my husband? It's a step in the right direction, but he needs my touch. He needs me to hold his hand. He needs me to be close to him. I don't have to be, in his face, but he needs me to be able to touch him. I wonder how much progress he might have been able to make in the past year if he had been able to see his doctor, if he had been able to have me come in and work with him. How far ahead would he be, instead of being a 55-year-old man who lays in a bed with nothing? He needs stimulation, and that doctor could have been helping him. And I have no idea. He really believes he could have some quality of life. And so it makes me very emotional and very angry to see how he's been treated. You can go to the Michigan Caregivers for Compromise on Facebook and ask, and you will get story after story after story like mine, and a lot of people who've lost their loved ones without ever seeing them, or they just could come in at the last hour of their life. We're protecting people. We say we're protecting people, and I know everybody's trying to do their best, but we're harming these people who have nothing else, like was said earlier. Everyone in my husband's nursing home has been offered 2 doses of the vaccine, and it's time to let their loved ones in to love them. Thank you.
All right, very brief. Rep. LeGrand.
Yeah, briefly. I think that was frankly brilliant testimony. Thank you very much. I think your central idea of a designated caregiver is an obvious good idea, and I certainly tell you, I will do everything I can, and I'm sure all of us will do what we can to advocate for better policies here. And thank you for encapsulating. This is hard, right? And we need good ideas. We need people who are on the ground experiencing this. So you did a great job. Thank you so much.
Thank you.
That being said, we're not the governor, we're not DHHS, so we will advocate for you, but I
Right.
really hope that you will go and try to make those points to those agencies too. So
Thank you. Thank you very
Rep.
much.
Riley, keep it brief, please.
Yeah, just, I know you just got done saying this, but this is so ridiculously stupid what we're doing in the state. Could you just clearly say what you think you would do if you didn't have all these rules impeding you?
What I would do with my husband?
Yes.
I would have been taking him to the doctor, who's going to help him with his brain twice a week. I would have been there every day in between those visits, doing the things the doctor was showing me to do, and I was videoing, to do this, and he'd give me a tool, do this with him, I would be doing that with him. I would be there, his nails are long, his hair is down to his shoulders, and, they've done a good job keeping him healthy, but I would be doing those things that they need to be done. And the nursing homes just don't have the time without the family in there helping. They try, but they don't have the time to do all the care things. And also, he would feel loved.
Great, thank you.
Thank you.
Thank you for coming in and sharing your story.
Thank you so much. I really appreciate it very much.
Next on Zoom, we have Kim Galdis on Zoom. We can pull that up. Go ahead, Kim.
Am I on, Steve?
Yep, we can hear you.
Okay. I lost both my parents during this lockdown. Here is a picture of them, if you can see it. Neither one contracted or died of COVID, but they suffered physical, mental, and emotional distress because the sole focus was that single virus. For them and many others, the cure was worse than the virus. My parents were born in 1924 and 1929. They faced life's adversities with optimism and perseverance, only to suffer the last months of their lives due to these egregious anti-family policies. Milestones passed without their loved ones. In March, they had their 70th anniversary. April, Mom's 91st birthday. May and June, Mother's and Father's Day. The 2 weeks to flatten the curve kept extending, stealing precious time from my now frail and vulnerable 91 and 95-year-old parents. Prior to the lockdowns, life in their top-tier expensive assisted living facility was better than being isolated in their home when driving wasn't possible. They could enjoy the dining room, church, social activities, group fitness, haircuts, access to healthcare, all without leaving the building. It was a happy, healthy, vibrant community. Family partnered with caregivers to assist in all aspects of daily living based on the residents' needs. I emphasize that because that's what the previous testimony stated, that it's teamwork, that we're there to help. The caregivers were wonderful. Those day-to-day people were, but they were unable to meet all those needs that frankly increased. The lockdown turned their home into a prison. Residents were confined to their rooms and isolated, being subjected to cruel and unusual punishment by removing access to family and activities. It led to confusion, frustration, anxiety, and depression, keeping them safe from one virus, but exposing them to everything else detrimental to their health and well-being. Due to the inactivity, my dad's congestive heart issues worsened and led to a hospital stay in May, where family was also banned. Thankfully, I was allowed in the hospital one day through the grace of one doctor, and that was the last time anyone in our family was able to see our dad. My dad came back to the facility into rehabilitation wing, and even though my parents were in the same building, they weren't allowed to see each other. How do you explain the unexplainable? My parents didn't have dementia, but we were never able to logically explain why they couldn't be with family when none of us were sick. They were aware that quarantine was necessary for sick people, but why quarantine the healthy? At one point, my mom said, they are banning joy with all these rules. My dad died without family on July 6th. We had a very small funeral, and we were still unable to be with my mom other than that day to help her grieve. I took many phone calls because she thought that I hadn't told her that Dad died. She had become so confused about some of the recent events. Finally, because she was on hospice, we were allowed to visit Mom, just my siblings and I, to help with her care because she needed help with everything. She was bedbound and needed help eating, drinking, everything. And the stretched out staff could not do this. She died February 12th. She was my best friend, and thankfully my brother and I were with her. Quality of life is more important than quantity. I don't blame the facility in some ways because I think they truly feared losing their license. They feared that they were going to be in breach of whatever the recent rules might be. It changed all the time. My parents are gone, but these anti-family policies must not continue. I think when your governor says she wants to keep you safe, but deems liquor stores, pot shops, and casinos essential while restricting family, church, and funerals, you know they're not interested in your health and well-being. And personally, my health has suffered, and the cure has been worse than the virus with these anti-family, anti-freedom mandates. And this must change. I don't want to take up too much time, but this is a picture of my parents in February when I took them to a funeral with their friends, of one of their friends. That was the last time they were able to really do anything. There are many, many people suffering from these same mandates. And I just am so grateful to Steve Johnson, my representative who invited me to speak, also Mary Whiteford and Lynn Affendulis, who advocated for me way back in April. And I speak for many people too. And I just hope that all of you hear about these and think about each of these people, not just a random policy, and going forward will make some transparency and not some kind of unknown science that no one can understand or explain. Thank you.
Thank you, Kim. And I think you put it best when you said quality of life is more important than quantity of life. I couldn't have said it better. Thank you.
Absolutely.
With
Thank
that,
you, Steve.
Next, we're going to go to Karen Lineman on Zoom as well.
Oh, okay. Thank you for letting me speak today. I would like to talk quick about the hubs. From personal experience, the ombudsmen also have not been allowed into facilities, and they are usually the eyes and ears of kind of licensing and keeping track of things. The hubs that were set up in Detroit, to my knowledge, there was not one in Grand Rapids. One of the ladies from the nursing home where my mom is was sent to Detroit. It did not go well. Sending a 95-year-old 3 hours away doesn't work. She came back, and a couple weeks later she died. And another friend of my mom's tested positive at the nursing home, tested negative at the hospital, and thankfully she was allowed to go back to the nursing home because she would have been gone to Detroit too, and she was in her 90s. Our facility actually did open up a hub. It wasn't used first. They did have separate staff. It wasn't used at first. They shut it down. They opened it back up after the lady had gone to Detroit. So for what it's worth. This is something many families have been trying to accomplish since shortly after COVID started. I'm part of a group that's called Caregivers for Compromise. The group has added Isolation Kills Too to the name, as currently we are beyond just dealing with COVID. The national group was started on Facebook in Florida by Mary Daniel, who got a job as a dishwasher in her husband's facility. That national group now has over 14,000 members. There are also groups for each state. Michigan's group has over 600 members. We understand the predicament that facilities are in, and this is not a reflection on staff. My name is Karen Lineman. I am an advocate for my mom, Pat Vanderweide. On March 11, 2021, she will be 78. On March 11, 2020, my brother and I brought a cake for mom and staff. March 12, the day our dad died in 2018, we also planned to visit. Mom and dad were married over 50 years. However, I received a call that the facility would be closed to visitors due to COVID. The facility had also been closed to visitors sometime in December 2019 and January 2020 due to flu and gastro illnesses. The decision to have a loved one go to a facility is usually not made lightly. Most often, the level of care needed is more than what can be provided at home by family and friends. There are some resources available to assist with home care, but not enough. Our choice then becomes to find a facility with a good reputation, good staff to resident ratios, and a central location for family to visit, and all of this can cost thousands of dollars a month. During this time, most of us as loved ones are lucky if we have been allowed window or glass door visits. These have continued even into the winter months. When my sister and I visited our mom on Christmas Day by the glass door at the end of her hall, it was 21 degrees and blowing snow. Our loved ones are mainly in his or her room 24 hours a day, other than a shower time, or if somebody comes to visit that they can come out of their room. There is currently no communal dining and very limited activities. Our mom, even though she is not as verbal as she once was, has been and is a very, very social person. Residents are being physically protected, but at what mental cost to them and us? When lockdown first started, the orders facilities were eventually given were to allow video visits. That was first on the list and where most facilities stopped. They were even given money to purchase or shipped iPads. We were allowed to schedule Skype calls through the facility during business hours. This did not work for most of Mom's 5 children. We eventually purchased a GrandPad senior tablet and pay a monthly fee to allow Mom to video call or call us when she wants to, as long as it is charged and place where she can reach it, as she is now in a chair that does not allow her to move around her room. The chair was a change that was made during lockdown. Mom has been offered a mechanical stuffed animal, a cat or a dog for companionship. It has not arrived yet. Even when or if she does get the lifelike cat, it is a poor substitute for human connection, family, and real pet visits that brightened her days. March 12 will be a year. There should be better plans in place by now, especially with the vaccines. The flu and gastro illnesses have become a yearly event already that keep visitors out. COVID is still relatively unknown. So far, vaccines for flu and or COVID have not allowed for visits. Right now, we will supposedly be offered indoor 6-foot socially distanced, limited visits with masks and more than likely monitored. We will still not be able to hug or elbow bump our loved ones, even though staff is allowed to. Currently, there are so many restrictions and conditions from federal agencies for visits, it will still be a long time. The rules may have changed slightly, however, they have been that if a staff member or resident tests positive, there's a 14-day hold until visits can be allowed. We could get to day 13 and someone tests positive and the count starts over. Now the threat level of our county also needs to be considered. I received one outdoor visit with my mom in August 2020. Our second visit was canceled and not rescheduled. Technically, we are allowed to take our family members out of the facility. To not allow that would be cruel, inhumane, and a violation of their human rights, correct? For most of us, this is not a great option as many residents are not mobile enough to leave. This requires special transportation and several other accommodations that most families cannot make happen. When they get back, they may be quarantined again, but they are pretty much doing that already. We are asking for an essential caregiver designation to be allowed to prevent this tragedy from ever happening again. This is not a designation that would have had to already be put in place prior to an event. It is not only for health reasons or end of life. We are asking that a resident is able to choose 1 or 2 family members or friends that would meet the same requirements and protocols for staff. We ask that this designation not just be for COVID, but a permanent and immediate change. There also need to be very clear rules for all facilities to follow and not open to interpretation. Most facilities are already understaffed and underpaid. Loved ones often helped with their resident, freeing up staff's time for other residents. We family members truly appreciate the care that is provided. We care about the mental strain that employees have also felt. In conclusion, please consider, families were kept out and COVID still got in. Our loved ones, some already near the end of their life, lost a year of knowing they have not been forgotten. One final thought, how would you feel in our loved one's place? Thank you for your time, and we look forward to making plans that will work out for all of us.
All right, thank you. And I have one question, Representative Young.
Hello, thank you so much for your courage. I know how difficult this is. I know you mentioned, I'm from Detroit, and I know you mentioned the TCF Center a few times and how things didn't work out here. Since we've been in committee, it's actually been, I feel like it's been offered up as a suggestion, but I don't know if it would have worked either way. But I did want to just be certain that you're aware that the TCF Center was manned and operated by FEMA and not by Detroit Health Department. So I want to clear that up, get that on the record right now. It's not Detroit that did it. So, okay.
And I'm not saying that it was the facility's fault when she came back that she passed away. It's just, you can't send a 90-year-old 3 hours away and then expect them to be fine. And she was deaf, and I don't even know if her hearing aids went with her.
Condolences.
Well, thank you for your testimony. We have a lot of other people wanting to testify, but unfortunately we are out of time today. This issue isn't going away. It's one that we need to continue to address. To me, it still baffles the mind that COVID patients were allowed to go into a nursing home, but a family member who tested negative couldn't. In what world does that make any sense? So hopefully we can keep working on this and allow for family members to visit each other. It's not just COVID that's killing, it's loneliness as well. With that, seeing no further business, the Oversight Committee is adjourned.